Things can go wrong in the care of people with asthma in a couple of main ways. Firstly, the diagnosis isn't properly made using spirometry. Secondly, people can get hooked on temporary relief rather than treating the underlying condition. You see, asthma is caused by inflammation in the lungs, and treatment of asthma is aimed at reducing that inflammation. The treatment puffers that do that are called preventers. Then there are puffers for occasional wheezy asthma symptoms. These are called relievers because they give temporary relief. The important thing to realise though is they do nothing for the underlying asthma condition.
If someone's asthma is well controlled, they'll notice they can go about doing their day-to-day activities, not worrying about their asthma too much. They won't be waking up at night time as they probably were before their asthma was controlled. That nighttime cough will have been resolved. And they'll be finding that they may be still needing to use a reliever occasionally, maybe 2 or 3 times a week, but no more than that. So they won't have symptoms during the week more than 2 or 3 times during the week. And I think that means that for most people, they're feeling pretty normal.
Best practice treatment should firstly be confirm the diagnosis, elicit the symptoms, confirm the physiology, and consider the possibility that something else might be causing the symptoms. The next question is a regular treatment needed to improve those symptoms? In childhood, for example, intermittent treatment might generally be preferred. For adults with significant asthma, have become used to the use of a blue reliever type puffer, which gets their breathlessness better. The important question is whether in addition to that they need a preventer treatment. And this is generally an anti-inflammatory, taken regularly by inhalation, something designed to improve lung function and to reduce the frequency of asthma symptoms is the track down which we go. There are a whole range of preventers, horses for courses, but there will generally be something which is suitable for someone with significant asthma.
I play basketball twice a week on a Tuesday and Wednesday. I play indoor soccer, outdoor soccer and go to the gym as well. I find since I've been using my preventer, I've been needing to use my reliever less and less while I play sports. That being said, I always make sure I take one with me just in case my asthma does flare up. The preventers do make a huge difference.
I've seen dramatic improvements in asthma outcomes across many patients, but at the same time, I've seen many people living with symptoms of asthma and adverse events that could be avoided. Some of the things that people accept as part of asthma, but they could be rid of, include breathlessness. Too many people live with breathlessness that could be eliminated or at least substantially reduced. The need to use a puffer to relieve their symptoms of cough or wheeze or breathlessness. Again, many asthmatics regard that as normal, but we know we can eliminate it with good asthma care.
Reliever medicines and preventer medicines are different. So reliever medicines, the puffers that they use for relieving, people use for relieving, are to, as they say, relieve the symptoms. So they're to use when there's symptoms right then and there to remove those symptoms so that you can get your breath back. So it's a bit like first aid. You're dealing with something that's immediate. The preventer medicines are the medicines that are treating the underlying cause of the asthma. So they're the ones treating the disease. They're not relieving symptoms in the same way the relievers do. They're treating the asthma. So they're the really important medicines, the one you really need to keep taking because they're the ones that are preventing you having all those other problems that can come with asthma.
When you first use a reliever, I always use it as soon as I can feel any sort of tickle or tightness in my chest. Basically within 5 minutes I can breathe fine again. Yeah, it's good to have a bit of relief.
But relief doesn't mean you're treating the asthma. As I said before, the shocking statistic is that over 60% of people with asthma are not receiving the appropriate care. And the biggest mistake they make, sometimes encouraged by their doctors unfortunately, is to suck on their blue puffer too much, relying too heavily on them and not treating the underlying condition.
We do hear that people are relying too much on their relievers and not taking their preventers. We think some of the reasons for that are that, well, first of all, sometimes if you don't use your puffer correctly, you don't get the right dose of the preventer and you don't get the effect you need. So first of all, it's important that you're the medicine in the right way and you are using your puffer correctly. The other reasons are sometimes people's beliefs. So it may be that someone is worrying about the corticosteroids in the preventer puffer, and they are low dose corticosteroids. The amount of side effects you get from those are very, very, very small. Not at all like people taking oral doses, tablets of corticosteroids, which is what we all know about. We hear about people getting round faces and having problems with their bones. Those side effects aren't really a problem with the low doses we use in puffers. So sometimes it's people worrying about side effects, and sometimes it's people not understanding that the immediate effect that you get from a reliever is only immediate. It's not something that goes on and is going to treat the underlying asthma, and that the preventer, although it takes anything from 2 days to 2 weeks to work, will kick in, and when it does, it'll have a much longer lasting effect.